Acidity. Also known as heartburn, acid reflux and hyperacidity. Overview. Acidity is one of the most common ailments that almost every one of us might have experienced once in our lifetimes. In simple terms, it is a condition that causes excess acid production in the stomach. This not only causes discomfort in the stomach but also leads to other symptoms such as sour taste in the mouth, difficulty in swallowing, and indigestion. Key facts usually seen in adults above 30 years of age. Body parts involved: esophagus, stomach, intestine. Mimicking conditions: gout, peptic ulcer disease, achalasia, gastritis, dyspepsia, gastroparesis. Specialists to consult: general physician, gastroenterologist. Treatment: antacids, aluminum hydroxide, magnesium trisilicate AMP, calcium carbonate, H2 receptor blockers, famotidine AMP, ranitidine, proton pump inhibitors, omeprazole, pantoprazole AMP, rabeprazole. Prokinetic drugs: domperidone, metoclopramide AMP, levosulpiride. Coating drugs: sucralfate AMP, colloidal bismuth, CBS. Symptoms of acidity: 1. Heartburn, 2. Regurgitation, 3. Sour taste in the mouth, 4. Difficulty in swallowing, 5. Sore throat, 6. Indigestion. Causes of acidity: the stomach produces gastric acids that help in the digestion of the food. However, due to some causes, there are times when gastric acids are produced in excess, thereby leading to acidity. Factors affecting the function of the lower esophageal sphincter layer are also responsible for acid reflux. Some of the common causes of acidity include: 1. Food and dietary factors, 2. Lifestyle factors, 3. Ailments and medications. Risk factors of acidity: the following conditions are related to increased risk of acidity. Medical conditions such as asthma, diabetes, celiac disease, and connective tissue disorders like scleroderma, hiatal hernia, delayed stomach emptying, overweight/obesity. Pregnancy: women who are nearing menopause, women on hormone replacement therapy. Diagnosis of acidity. If you experience any symptoms of acidity such as burning pain or discomfort, also called heartburn, regurgitation or bloating or burping, with a sour taste in the mouth, then it is wise to consult a doctor. Your doctor might do some physical examination followed by a few questions related to your daily routine to know the cause of it. If your symptoms are mild, your doctor might not recommend any tests. However, if your symptoms fail to show any improvement post-treatment, or if you experience symptoms such as internal bleeding or difficulty in swallowing, then your doctor might recommend further investigation. The tests include upper GI endoscopy, pH monitoring, barium swallow test, esophagram, esophageal manometry. Prevention of acidity: there are a few simple tips and tricks that can help you to prevent and manage acidity. These include: eat small frequent meals, eat a low-carb diet, chew your food properly, avoid eating late at night, limit consumption of spicy and deep-fried foods, limit intake of caffeine and carbonated beverages, limit your alcohol intake, avoid strenuous physical activity right after eating, quit smoking. Treatment of acidity: the medications used to treat heartburn either work by blocking the production of the stomach acids or aid in neutralizing the stomach acid. Based on their action mechanism, these drugs are classified into 3 main categories, namely, antacids. Antacids neutralize the stomach acid to provide relief from acidity. Also known as stomach acid neutralizers, antacids are known to provide quick relief. These are available in the form of tablets as well as syrups. Examples include aluminum hydroxide, magnesium trisilicate, magnesium carbonate, calcium carbonate. The side effects of antacids are based on their ingredients. For example, antacids containing aluminium hydroxide might cause constipation as a side effect, whereas those containing magnesium hydroxide can lead to diarrhea as a side effect. The long-term effects include gas, belching, swelling of the feet and hands, constipation, and diarrhea. H2 receptor blockers: these medications block specific receptors present on the stomach cells that release gastric acids, thereby helping to fight acidity. These are also known to aid in the treatment of damaged tissues in the stomach caused by peptic ulcers, gastritis, or stomach inflammation. Some of the common side effects of drugs belonging to this class include abdominal pain and diarrhea. These are not advised to be taken by pregnant women as these can cause abortion and teratogenic, fetal defects. Side effects. Examples include famotidine, ranitidine, nizatidine. Proton pump inhibitors, PPIs, they block and reduce the production of stomach acid to relieve acidity. These are available both over the counter and as prescription drugs. It is usually prescribed to people who do not show any improvement post-diet and lifestyle changes or experience gastric symptoms on a regular basis. Side effects of these medications are rare but may include headache, diarrhea, and stomach upset. The long-term health effects of these medicines are not yet known, so talk to your doctor if you are taking PPIs for a long time or in high doses. Examples include omeprazole, pantoprazole, rabeprazole, esomeprazole, lansoprazole. Coating drugs, also known as ulcer protective drugs. This class of drugs protect the esophagus and the stomach by forming a protective layer over the surface. It is mostly recommended for short-term action and is considered to be safe. These are mostly recommended for use in people suffering from stomach ulcers and peptic ulcer disease. Examples include sucralfate carboxylone colloidal bismuth, CBS. Prokinetic drugs. This class of drugs are prescription drugs which are known to act by promoting normal contraction of the esophagus and help in the emptying of the stomach. These are commonly recommended for people with GERD and mostly in combination with medications that lower acid production in the body such as PPIs and H2 receptor blockers. Some of the common side effects of these drugs include diarrhea, drowsiness and agitation. Examples of drugs belonging to this class are domperidone, metoclopramide, muspride, levosulpiride. 8nine Healthify World. It's all about health, wealth and care by Kunal Rao Rane.